Welcome to the Philips Healthcare demonstration of the Philips Respironics AF541 Non-Invasive Mask. Uniquely designed for flexibility and comfort, the AF541 is Philips' latest innovation in non-invasive technology. This short instruction video is intended to help you understand features, sizing, application, and the added capability of performing mask rotation with a single frame and two cushions. The AF541 is an oronasal mask with interchangeable components, including under-the-nose and over-the-nose cushions, detachable frames, and swappable headgear. The mask's design offers many of the benefits of nasal and pillow masks, allowing clinicians options for selecting the right mask for their patients. It is configured to support comfortable movement for the patient, achieve the benefits of mask rotation while using a single mask, and provide easy access to the patient's face and mouth, all while providing effective, non-invasive ventilatory support. The over-the-nose and under-the-nose cushions of the AF541 mask can be used on their own or interchangeably with a cap strap or four-point headgear. Even though one is positioned over the nose and one is positioned under the nose, both are considered full-face cushions, and when attached to a headgear, they create a full-face or oral nasal mask. The cushions are designed to be self-sealing, which helps minimize over-tightening the mask. The over-the-nose seals are similar to other Philips oronasal masks, while the under-the-nose seals are similar to a nasal pillow cushion. The cushions are contoured in a way that helps provide extra support and comfort when the mask is in use. The under-the-nose cushion does not come in contact with the nasal bridge. Alternating the cushions on the AF541 mask offloads pressure points on the skin to better support your mask rotation strategies. Depending on hospital preference or protocol, patients will start on one type of cushion and can be rotated to the other cushion during the course of their therapy. Made from materials that do not contain BPA, the AF541 is comfortable and easy to use with a push-button forehead pad that enables simple adjustment and stability. The elbows feature sturdy push tabs that audibly click into place and release. Along with a convenient nebulizer port, the intuitive talon clips can be removed with ease for quick access to your patient. And the AF541 mask design allows the frame and cushion to rotate 90 or 180 degrees for access to the patient's face and mouth for convenient provision of oral care, taking oral medications, and therapy breaks. The AF541 mask has a lower profile than other Philips masks, which makes it appear smaller. However, the size of the opening on the AF541 is roughly the same as masks of equal size. With each mask, a sizing gauge is included, and you'll want to use this to measure the appropriate size that best fits your patient, and to determine both under-the-nose and over-the-nose cushion size. Sizing for over-the-nose and under-the-nose are completely different measures and are not correlated. Over-the-nose cushion sizes range from small to extra large. When sizing the cushion, have the patient slightly open their mouth and line up the crease between the lip and the chin to determine the right size. Under-the-nose cushions come in four sizes: extra small, A, B, and C. When sizing it, gently place the sizing gauge under the nostrils until it lightly touches the patient's skin. The line that the tip of the nose falls on is the correct size. Should your patient be between sizes, it's recommended that you use the larger size. You'll also want to keep the sizing gauge at the bedside for future use if the alternate cushion type is used. Keep in mind that the mask is available with either cushion type pre-assembled, and the alternate cushion type is available as an accessory piece. After you have sized the patient, make sure the desired cushion is assembled to the headgear. Now, take the mask and headgear and place it over the patient's head. Then secure the top headgear straps by adjusting both straps simultaneously. You'll want to use the top strap adjustments to ensure that the upper head strap is in the optimal position vertically. Next, connect the lower talon clips to the mask frame and adjust the lower straps simultaneously, making sure not to over-tighten. After that, you are ready to connect the circuit to the mask and customize the fit by adjusting the frame slider and then the lower straps. When you push the button on the top of the frame slider, you may adjust the position of the frame relative to the patient's face. This will help minimize leakage around the patient's eyes. Reassess the lower strap tension following the adjustment of the frame slider, along with the mask angle, mask leak rate, and position. Consider asking your patient if the mask feels comfortable on their face. The bottom of the cushion should rest just above the chin, with the mouth slightly open. Also, tightening of the upper head strap will not address leakage around the cushion, so be sure to manage this by adjusting the frame slider, ball and socket adjuster, and lower strap tension. For your convenience, to help with workflow, you can attach the plastic mask tray to the optional clean clip holder and use it as a docking station during rotation or periods of non-use. Once the mask is on and connected to the circuit, ongoing adjustments may be necessary to manage the leak due to changes in patient position or settings on the ventilator. And keep in mind, the mask fit doesn't need to be airtight to deliver effective NIV. In fact, over-tightening may actually create a larger leak by defeating the self-sealing design of the cushion. Leaks around the nose and eyes should be addressed using the frame slider, which adjusts inward to tighten or outward to loosen. During non-invasive ventilation, it is recommended that you have a patient leak, and this leak should occur at the bottom of the mask near the chin. Leaks around the chin area at the bottom of the mask should be addressed by adjusting the tension of the lower straps. Leaks at the sides of the mask may be addressed by adjusting the mask angle using the ball and socket or lower straps, but high leaks in this area may be best addressed using the under-the-nose cushion. If leaks are seemingly unmanageable through angle or tension adjustment, the mask should be reassessed or resized. With the AF541, you have easy access to the patient's mouth and face by removing the talon clips using a simple twisting motion, and then rotating the mask frame 90 degrees in either direction laterally, but not away from the face or outward. Once the mask fit is customized, temporary or prolonged mask removal or movement should be done by releasing the talon clips and not by undoing the strap. For prolonged mask removal, consider removing the mask frame from the headgear by disconnecting the ball and socket connector. When reconnecting the ball and socket connector, be sure to support the ball with your fingers when attaching to the socket. The AF541 uses an interchangeable elbow system, and there are currently 4 elbows available, including an opaque leak, also known as Leak 1EE, an orange leak, also known as Leak 2EE, a blue non-vented elbow, also known as SE, and a green bronchoscopy elbow. Each elbow has a NIV port included to facilitate the use of an Aerogen NIV aerosol generator. The NIV port is covered by a silicone port cap. The Leak 1 elbow shown is intended to be used with a dedicated single-limb BiPAP circuit that incorporates a dedicated exhalation port, such as the disposable exhalation port, or DEP. The Leak 1 elbow has a minimal intentional leak that is not sufficient to eliminate exhaled CO2 from the patient and should not be used with either a straight tube or 2-limb breathing circuits used with critical care ventilators. The Leak 2 elbow has a leak port built in and is designed for use with either the dedicated BiPAP circuit or straight tube used for home care applications. With the Leak 2 elbow, use of the disposable exhalation port is acceptable with the V60, V30, Vision, or Trilogy ventilators, and the intentional leak will be cumulative, but within the leak compensation range of these devices. When using a Leak 2 elbow with the DEP circuit, the caregiver should carefully monitor patient leak with the understanding that there are 2 intentional leaks in place. The V30 and Trilogy only monitor and display the total leak, which includes the intentional and unintentional patient leak. Clinicians should also make sure that the Leak 2 elbow and DEP has been selected on the V60. Use of both the Leak 2 elbow and disposable exhalation port is not recommended with home care BiPAP or CPAP units due to limitations to total leak compensation with these types of devices. The blue non-vented elbow is designed for use with a 2-limb ventilator circuit attached to a critical care ventilator with a functioning safety or anti-asphyxiation valve. It does not have any built-in leak and should not be used with a dedicated BiPAP or CPAP ventilator using a single-limb circuit. Elbows may be removed by pressing the retention clips on either side of the elbow. Elbows may be attached to the mask frame by pressing straight into the opening on the front of the frame until an audible click is heard, which indicates that the retention clip is engaged. A green bronchoscopy elbow is also available, but you should note that the AF541 elbows are not compatible with either the AF531 or Performax elbow systems. By regularly rotating between masks or the over-the-nose and under-the-nose cushions on the AF541, you can offload and redistribute pressure. Skin breakdown for your patient can be difficult to manage and quite costly. For example, in the United States, stage 3 and 4 pressure injuries are classified as a preventable hospital-acquired condition and are no longer reimbursed by current insurance guidelines. Alternating the cushions on the AF541 mask may help to offload pressure points on the skin to better support your mask rotation strategies. By replacing the cushion instead of the entire mask style, it's also a cost-effective strategy that enhances your workflow. Remember that one of the cushion types will come pre-packaged and attached to a mask frame. To remove either cushion, squeeze and twist the cushion while securely holding the mask frame. The cushion may be attached to the frame by pressing straight into the frame until an audible click is heard, signaling proper attachment. In addition to rotating cushion types, the Philips Respironics Performax mask may also be used. Just remember that the elbows on the Performax and AF541 are different and not interchangeable between these two mask types. In addition to mask rotation, you can use Liquicell sealing membrane or other skin barrier products to minimize shear forces, friction, and pressure injury at specific pressure points, usually on and around the nose. Use of thinner barriers is recommended to minimize leakage around the eyes and nose. Skin assessments should be performed routinely during non-invasive ventilation therapy, and steps should be taken to prevent or limit the progression of pressure-related injuries. For additional information on the AF541 or any of Philips masks and circuits, please visit philips.com/healthcare or contact your local Philips representative.
Innovation in you. Philips.